Dr. Planty, I have heard that an optometrist, anyway, an eye doctor doing the eye examination is one of the most qualified, and it's due to the fact what he examines, which is the eye, that he can detect diabetes just about faster than anyone else, the onset of diabetes. Is that true?
That's very true. During the routine eye examination, one of the things that we are required to do by state law is to make a statement or examine the overall health of the eye. And in order to do that, we have to look inside the eye. And diabetes, if people have it, they know that they can go blind from their diabetes if it goes uncontrolled or unmedicated. So taking care of your diabetes will help save your vision at that point. But some of the things that we see inside the eye, what people don't understand about diabetes is that it makes the veins in the arteries very brittle. So you could have a busted blood vessel inside the eye. Blood leaking inside the eye could interfere with your vision at that point, and we're able to pick up on the hemorrhages that are in the eye as the result of diabetes. The other thing that can happen is initially you'll get some swelling that happens inside the eye around certain structures inside the eye, more particularly the macula, that will interfere with your vision, and we can see that before a patient even knows they have diabetes. So another good reason to go ahead and have your eyes examined on a yearly basis. If you have a family history of diabetes, you may not have it, but if an aunt, an uncle, a grandparent, or a parent, or another sibling has diabetes, you might want to get your eyes checked out so that we can catch that at the very earliest point. And, you can control that with diet. You can control it with pills. It doesn't necessarily have to be insulin. But if you can control that, you're going to end up seeing clearly a lot better, a lot longer in your life if you can get that under control.
Wow.
And we can determine that before anybody else can, other than a blood test at that particular point.
I see. Well, that makes sense because obviously, I think the eye is obviously a very fragile thing, just stick a match in your eye versus in your chest. It hurts a lot more in your eye. So basically the blood vessels, they get brittle, as you say, things are happening to that. So it's going to show up much faster there where they're a little more fragile than, where it is nice and solid. And so you can detect it faster and then a person can take recommendation. Now, you said something. People can go blind from diabetes. Is that a whole different? Well, that's diabetes blindness. That has nothing to do with glaucoma and with macular degeneration and with cataracts.
Does not. And really, the only people that are going to go blind from diabetes are the patients that don't take their medicine and they don't do anything to take care of the diabetes. Essentially, you see the patients that lose fingers or lose toes from diabetes because of the fact that if they don't control their diabetes, all those busted blood vessels in their toes and in their fingers are going to create some issues with to where they might have to have their fingers amputated or their toes amputated. But it's only going to happen with those diabetics that don't listen to their doctor, don't take his advice, and don't take the medicine or the medications the way they're supposed to. They're going to get into all kinds of complications that they don't really want to get into. And to go blind from diabetes is totally preventable, and it's absolutely absurd if anybody allows their diabetes to take their vision like that.
Right. However, the question started off with a eye doctor can detect diabetes as fast and faster than anyone else, and that in itself got to be a good thing.
Absolutely. And for the same reason, we can be able to detect high blood pressure in patients before they exhibit any of the other classic signs of high blood pressure. Again, with high blood pressure, the vessels inside the eye will hemorrhage, and we can kind of tell that you've got high blood pressure that's coming on at that particular point.
So high blood
pressure and diabetes are two things that we can diagnose quicker than anybody else.
And definitely, whether the person might know that he has high blood pressure, but you kind of already can see that, yes, it has some effect on you already.
Absolutely. Absolutely. Because if it's happening in the eye, it's happening in other blood vessel areas around the body, whether it's in the legs or whether it's in the arms or whether it's in the chest. We're going to be able to see that.
Wonderful. Well, Dr. Planty, appreciate you telling us all about it. Very informative again. Bye-bye.
Bye-bye.